Cooper.
Cooper, take one.
Drug resistance in bacteria is one of the major global health problems that we're facing now. So increasingly, bacteria that cause serious infections are becoming resistant to antibiotics we use. And this is particularly a problem in Asia, in Southeast and South Asia, and particularly in lower and middle income countries, where in some cases actually we're already seeing infections which can't be treated with antibiotics available in those countries. So, and the risk is that resistance will continue to spread more and more, and that we'll see more commonly infections which we don't have antibiotics to treat them with. The great thing about when you have a mathematical model, you can start to use it to answer what-if questions. So what if we increase hand hygiene by 20%, say, what impact would that have on how the bacterial infections spread and how many infections the patients get? Then we can go on, as we get better mathematical models, so we need to fit these models to data. As we get more reliable mathematical models, we can increasingly ask what would be the impacts of changing the way we use antibiotics on how much resistance we see. So we recently published a paper that analysed data from all the sort of highest quality hand hygiene intervention studies and found good evidence that actually this intervention can significantly improve hand hygiene, and that appears to be associated with reductions in infections with certain drug-resistant bacteria. And also we've used mathematical models to show how increases in hand hygiene can be associated with substantial reductions in certain resistance infections, and also recently how this can be a very cost-effective intervention. So this kind of work feeds into policy decisions made by governments to invest in hand hygiene campaigns. So and that has happened already in previous work in Europe, and we're hoping it's going to happen increasingly in lower and middle income countries. Similarly, actually, maybe one more thing. So I've done some work on pandemic influenza in the past and looking at using mathematical models to look at how movement restrictions, whether shutting down airports, stopping people travel, would impact on the spread of pandemic flu. And actually that found, surprisingly, it would have very little impact. And this also work fed into sort of international recommendations on how to respond to a pandemic.
Ben, what important lines of research have emerged in the past few years?
One of the biggest changes in the last few years is the emergence of very cheap sequencing technology. So it used to be incredibly expensive and hugely time-consuming to look at the DNA sequence of a particular bacteria. It's now about $100 to get the whole genome sequence of a bacteria. So this means we can get very, very detailed information on the DNA of the bacteria, which we can use as a kind of barcode, and we can use that barcode to identify how these bacteria are spreading between patients. So this is really potentially huge impact on how we can understand how bacteria are spreading between individuals. The research into antibiotic-resistant bacteria matters because antibiotics are incredibly useful. They've had a major impact on human health since they were introduced, and the threat of antibiotic resistance really risks putting us back into the pre-antibiotic era. And we're already seeing that in some cases, that patients have infections where antibiotics are not available, which can treat them. And the risk is that this can happen more and more. So we really need to find strategies to combat the spread of resistance. So the first aspect of our work is to understand what's going on, is to understand how bacteria are spreading. The second aspect of the work is to really find what interventions work to stop this resistance spreading and to improve patient outcomes. The third aspect, when we found effective solutions, is to actually try and translate them into changes in policy or changes in practice at a national or international level. So one aspect of the work that I think helps a lot with that is when we combine analyses with cost effectiveness, because we can show not only does the work, is a certain intervention likely to improve patient outcomes, it's actually worth governments investing in that, it's actually something they should be doing.